So welcome everyone to the Healthy Places Grant info session, and welcome to those who will be watching this in the future. We will be here together for probably a little under an hour, so I want to do some welcome and housekeeping before we get rolling. I am Sarah Tilley. I'm a program manager here at Lorain County Public Health. And I am joined by Andrea Ferguson and Kat Solov, my colleagues who also work with me in the Health Promotion and Chronic Disease Prevention team. So we will be walking through everything today. Andrea and Kat will be helping. They'll be here to answer questions and also to monitor the chat. So anything you want to say before we get to the end, please make sure to enter it in the chat box. They will keep tabs on it and you will not be forgotten. Another quick housekeeping item. This is a Zoom meeting format, it's not a webinar format, so we do ask that you keep yourself muted while we're going through the presentation, and if you somehow become unmuted and we hear some background noise or chatter, we're going to go ahead and remute you. So please don't be offended, but in order to keep things going and to keep everything quiet, we'll be making sure that background noise is off. Any questions you wish to ask using your mic in like a real voice, we can wait till the end. Otherwise, chat questions are also totally great. So let's go ahead and get started. The purpose of this meeting today is because Lorain County Public Health is once again offering Healthy Places grants to Lorain County organizations that aspire to build healthier communities through built environment changes. We really hope that these grants will create a long-lasting impact on the health of our communities, especially those underserved communities in our county. So in order to lay some basic groundwork, so we're all working off the same information, we're going to go over quickly what the built environment is. It is the physical characteristics of a community where we are living, working, and playing. These are more permanent fixtures and they make up everything that we see and interact with. So we're thinking about playgrounds and green spaces, parks, also walking trails, side paths, bike trails, sidewalks, all those places where we're transporting ourselves via human-powered transport, such as walking, biking, rolling. We're thinking about the public art that makes up our community and where we hang out. This is not just parks and green spaces, but also public plazas and other spaces where humans like to socialize. Built environment also includes some shared use spaces like community gyms or school gyms that are open to the public for free in off hours or after hours. This also includes outdoor and public fitness equipment. You might be familiar with these in some of our metro parks in Oberlin and in North Ridgeville Central Park, but it's the fitness equipment that's out and available to use at any time for free. And finally, the built environment includes community gardens and urban farming, spaces where anyone can come and participate in growing your own food or the local food system. So Lorain County Public Health is very interested in the built environment because it impacts our health in a lot of ways. A community that is healthy and whole promotes being active. It allows people to get in their physical activity in a way that they feel safe and welcome. The built environment can encourage eating healthy, accessing healthy foods, and also accessing healthcare. We also know that these systems, when built appropriately, prevent injury and promote safety, especially in the traffic safety realm and the community safety realm. Communities that have a good built environment have improved air quality, water, and soil quality. And these natural and green spaces not only encourage us to work on our physical health, but also our social and mental health. We know that having access to these types of spaces can encourage social connectedness and also mental well-being. So the built environment really should be accessible by all community members, and not only physically accessible, but socially accessible as well, meaning that anyone feels welcome in these spaces no matter where they come from or who they are. So that's where we're coming from this year. We've done a lot of iterations of these grants, and last year, if you applied or were awarded funding, there was a component that was a little more program focused. This year, we are trying to focus more on the physical changes, the built environments, and bigger projects. So this year, there's $100,000 available in total to all grantees. There is a maximum amount that you can apply for, but there is no minimum. So no grant can ask for more than $25,000. We're going to be trying to fund as many projects as possible. We don't want you to read this as 4 grants available. We want you to think about, can your project have the green light or be a go for under $25,000, or we also might be looking at partial funding. So you might apply for 10, but we can give you 7,500. Does that work out? So do not feel like you have to apply for the maximum, but that's where your ceiling is. So in order to get this all done this year, there are some key dates. Our applications opened last week. We're all here today. And then in the future, we have February 18th is the deadline for technical assistance. So if you want to toss around ideas, brainstorm, think through pieces of your application, or have us read your project description for clarity, we ask that you do that by February 18th. So we have the appropriate amount of time to help you. All applications are due on Tuesday, March 1st by midnight. So time stamped by 11:59 p.m. We will be notifying awardees by Monday, March 14th, and that kind of leaves us from the middle of April to December 31st, 2022 to complete our grants and do everything we said we would. A few of the boring pieces of the application, the check boxes. So eligibility to apply, only projects in our health department's jurisdiction are eligible. This means all of Lorain County with the exception of Vermilion. If you're from Vermilion, we sincerely apologize, but you are under the Erie County Health Department jurisdiction. All applicants must be a government agency or nonprofit. We are not funding private for-profit companies, and we will not be awarding funds to individuals. Applicants must demonstrate partnership with at least one other entity. That's a minimum of 1 partnership, but you can include as many as you would like. And when we say the word partnership, we're thinking outside the realm of a letter of support. While letters of support are required, we will also be looking in the actual application to understand what this partner is bringing to the table and how they will be involved, whether it's helping to promote and communicate your change, whether they will be doing a program on site, or they'll be evaluating your project. So think outside just the letter of support. All of our grants will be awarded via reimbursement of funds. So this means that the grantee must purchase the equipment or pay for the services that they have outlined in their proposal. They then submit an invoice to us, and we will cut you a check back to cover the cost that we all agreed upon in the contract. All invoices for this project will be due by November 15th, 2022. If that is not possible, please consider whether this is going to fit inside your timeline. We are flexible. We're not unfeeling when it comes to how the pandemic impacts supply lines and deliveries. So if something happens, but just know if you want to receive reimbursement within this calendar year, you do need to get your invoices in. If for some reason invoices are submitted later than that date, your payment might be delayed until February of 2023. A few things we're not going to cover and we cannot cover. We will not be awarding funds for personnel costs. These are the regular employees working for your agency or organization. We won't be covering personnel, fringe, anything that is within your normal operations. What we do cover is contracted labor. So we don't expect you to be an expert at paving and installing equipment. So if you need to contract out labor costs to have things done, installing changes, that is allowable. We don't cover food, so we're not gonna pay for your pizza party at the kickoff event. We don't cover bad debts. We do not cover fundraising. So if you need to raise additional funds to cover any part of your project, we cannot pay for promotions or ads. We do not advance political or religious points of view. We do not conduct event sponsorships, and we do not cover costs to rent space. There are a few additional requirements you can see outlined in the application that will be required of you if you're awarded. Every awardee must complete one site visit. We generally schedule these towards the end of the grant period when things are done. You will be required to complete an evaluation at the conclusion of your project. Those details and specifics will be outlined to you towards the end of the project. We'll guide you through that. You also give us permission to use and share photographs of your project and promote anything related to the grant through a press release and other media outlets. You also kind of agree to let us look over your promotions that you plan to do internally. We usually like to do a quick proof. We're not looking to change your work, but we generally like to make sure you're not promoting Lorain County pubic health and you've missed that very vital L. So we do look over promotions, but not in a way that's going to change your project, just to make sure all the details are correct. And at any time, you can discontinue funding with 30 days of written notice, and we will reimburse you for expenses up to that date. So again, if you are still interested in applying and this is sounding okay to you, loraincountyhealth.com/healthygrants is where you can download all the application materials. These materials must be filled out completely and they must be typed. We cannot accept handwritten applications. And we also may decline or defer an application that is missed sections. So it's pretty vital to make sure everything has been hit and you have all pieces complete. We outline in the application that you can email it in and we will confirm that we've received it, or you can drop it off if email is not working for you with the size of your file. So here's our beautiful web page. Everything is here. Everything we're going to talk about is here. And you can download the application in a PDF format. So that's a fillable PDF or a Microsoft Word document and type in the Microsoft Word. The fillable PDF might be a little more straightforward because we have boxes up there for you to fill in. But if for some reason PDF is not working for you, please use the Microsoft Word document. So the actual application, getting into how things are different this year. We have a slightly adjusted application. So if you've applied in the past or you've looked at past applications, there are some changes. Some important pieces to note: we're going to need a description of your agency and a signature and approval from your organization head. This might be your director, your CEO, your commissioner, but please make sure whoever has the authority to make the final decision for your organization signs off on your grant application. We also will need letters of support from all listed partner agencies and some information from them that's outlined in the application. We also will be asking for a summary of your project. Give us your elevator pitch, your 30-second, what is this and what's going to be happening. We'll request that you tell us how much funding you're asking for, and new this year is who is impacted. So there will be a checkbox that I've kind of pasted on this slide. We really want you to identify who is going to be impacted by your project. There's a lot of special communities in this county and they have special health needs. So identify who that is. If they're not in the checkbox, we give you space to click other and describe who that population is and why they're important. But we've kind of started off with a list here. If you dive into our appendix, Andrea has pulled together a beautiful little summary of relevant health data broken down by geography. So please refer to that if you need a jumping off point for understanding how your population might be affected. We also ask that you select project type this year. So we are really hoping that these projects fall into one of these 5 categories, either active transportation, safety and inclusivity, arts, culture and placemaking, physical activity, recreation, and or nutrition and food systems. So a little bit different this year. Make sure you look at those check boxes and outline that for your project. We'll also be asking you a few questions to tell us more about your story, give you a chance to explain why this is a good project and why now is a good time, and also spell out what is the long-lasting impact, how will this really change the fabric of your community. Also, as with past years, this year we would like to see a work plan and a budget. There are templates for download on our website. Please use them. They are simple and they don't have to be anything crazy, but we do ask for some good detail. So here is an example of the work plan. You can download the template, and inside the template, we have this sample. Basically, the work plan is where we need to see as much detail as possible. A lot of times with our grant reviewers, it's hard to understand really what steps you're going to need to accomplish your project, and the work plan is a great place to spell that out. You can list the activities step by step, tell us when you think they're going to be completed, and also talk about who's responsible. It's a great time to include where your partner might be stepping in to do some important parts of your project. So this is a sample work plan. Again, it's available for download in the template. More details make it easier for us to understand what you want to do. Even if they seem silly, like of course we have to install a playground, spell it out and help us out so we can know exactly where you're going. Also, there will be a budget with projected expenses. We ask that you attach quotes and estimates so we can make sure that where you think the budget needs to be makes sense, and you have kind of thought about where the costs are going to be and what they're going to be. But more importantly, a detailed budget helps us to better understand your project and award partial funding. So back in the beginning, I noted we might be awarding partial funding. It is so much easier for our grant review team to award partial funding if you've spelled out line item costs. So if you ask for $10,000 to do a new playground and we can't award $10,000, it's really hard to make a call on what a appropriate partial funding would be. But if you ask for $5,000 to purchase playground equipment, $3,000 for installation, and $2,000 for mulch, then we can start to look at the application and say, you know what, we think that we can find a different funding source for mulch, or we know a partner who does free mulch. So it helps us to piece together the background pieces and parts of your grant to make your project a go while still awarding partial funding. In the application, we've included a scoring rubric. So going through it quickly now, there are 100 available points when we're reviewing your application, and the bulk of the points come from the work plan. So again, a detailed work plan is worth a lot of points. Also new to this year is if you are going to be a first-time mini grant awardee, if we've never given you funding through this program in the past, you get an extra 5 points. We're really looking to fund diverse agencies, to fund projects we've never funded before. So there is a little additional 5% bump for those agencies. Other things to note, please make sure it's a built environment change. That's worth a good chunk of points. And budget, reaching a target population, and demonstrating partnerships are all worth about equal points. So that's the basics of the application. Just in case you're kind of running through your brain what might work, here's a couple examples of past funded projects. we helped to fund Rowland Nature Preserve's playground over in Elyria Township back in 2015, which was 7 years ago. We've also helped to fund the community garden in Oberlin at Legion Field with partnership with Design Community Development Corporation. Just recently, we installed pathway lighting at Horizon Education Centers in Elyria and Lorain. So they already had an existing path and they wanted people to be able to walk during these dark daylight savings times. And adding lighting was a great project to extend the life of that change. We've also funded bike racks, park enhancements, pavilions, anything that makes a space more inviting. Again, outdoor fitness equipment, as we noted, this is down in Oberlin, and then bicycle lanes up in Lorain. So we're reaching the end of the slides. I guess it's time for questions, but at the last 3 points, you can ask us for help and we can review details, but we just ask for that by February 18th. So we can, give you ample time to get back to work on writing. So that's the end of me talking at you for 22 minutes. Are there any questions in the chat?
Not yet.
No questions. If you have questions, feel free to type them in now, or if you want to ask a question out loud, unmute yourself and join us.
It's Marie Deschik, Stephen DeHana's principal. Will you share this PowerPoint? Because that's some great ideas.
Yes, we will share the slides and we will also post the presentation on our website, most likely today, if we can get it up for the snow.
Sarah, can you repeat where we email questions about our grant proposal?
Yes, so you can email me, stilley@loraincountyhealth.com with questions. And it's at the bottom of this slide. So when we post them, you can also go back if a pen and paper aren't handy.
Sarah, this is Bethany Gowers with the Licata Way. Can you tell me, is there a target number that the Lorain County Public Health is looking for the number of impacted individuals?
That's a great question. There is no target impact number we're looking for. We recognize that measuring impact for these projects is extremely tricky and can get expensive if you're talking about measuring people walking on a trail or something. So there is no target number. If you want to estimate impact and you feel that that might increase your odds of getting funded or better show us what's going on, we sometimes will measure how many people are within a half mile of a park. It's a good measure of access, but we know it's not a great measure of impact. So if you want to talk more through that, we can throw up some things on our website too about how to measure, people within a half-mile radius of your project, but no minimum. And we understand it's tricky. So if it's not within your reach to estimate the next month, it won't be held against you.
Okay, thank you.
From the chat, is there a sample letter for the letter of support from the partnering agency or organization?
Good question. We do not have a sample, but we could maybe pull one. We've written some in our lifetime, so we'll post that on our website so you can download that and reuse it. We'll get you a sample letter. Any other questions? Nope.
One thing I thought of is, I think Marie mentioned something about having good examples here in this PowerPoint. We also have examples from years past on the website, loraincountyhealth.com/healthy grants. So if you kind of wanted to see what some other people had did, you can check that out on there in case that's helpful. Oh, and another thing I thought of for evaluation, someone had asked about impact and how to measure impact or how many people you reach. And something kind of cool I think we're doing this year is when we evaluate you, we're going to ask you how you are going to measure success for this project, because success for a community kitchen would look very different than success for a walking path. So as you're planning your project, keep in mind what success would look like for this project, because during the evaluation process, we'll ask you that, and then you'll have to show us with data like that you've met your own definition of success.
Thanks, Sandra.
You're welcome. I haven't seen any other questions.
Okay.
Here, so.
Well, I'll give people 30 more seconds before we close out. Again, please visit the website, loraincountyhealth.com/healthy grants. It has everything you need. Oh no. I think the host muted me.
We can hear you, Sarah.
Okay, good. I keep getting this little message that says the host is muting me. So, okay, the website has everything you need. It is also going to have everything we just noted. We'd upload this presentation, the slides, and a sample letter of support. Any other questions, please feel free to email me, and we look forward to reviewing your projects and your questions as they start rolling in. Other than that, I hope everyone stays safe and warm during this snowstorm that is coming for us. And yeah, have a great Wednesday.